So my name's Lillian. I'm an advocate with the Nationwide Health and Disability Advocacy Service. I guess a bit about me. I have a background in psychology and youth work. I've been working for the Advocacy Service since the start of the year. There are 22 offices around New Zealand, so there's always someone to chat to. And what I do is, I guess my role is to help people if they have a concern about a health or disability service that they have received, and to help them get those concerns out, get them onto paper and sent to the provider. So what I do is, it comes under the Health and Disability Commissioner Act 1994, which stemmed from the Cartwright inquiry in the 80s with some unethical research that went on, which kind of led to an inquiry that changed the way that the doctor or practitioner relationship and patient relationship were viewed. So this legislation provides for the Health and Disability Commissioner, the Code of Rights, and the Advocacy Service, which is where I'm from. So I'll go through those things in a tick. The purpose of that legislation is to protect and promote the rights of consumers, but also to ensure that there's fair, efficient, and effective resolution of complaints. You know, that if something's gone wrong, it doesn't drag on for months and months, or God forbid, years and years. And that's sort of the purpose of that legislation. So now I would usually be giving out wee leaflets with these on, but the Code of Rights, you've probably seen the posters around. Providers have to have them on the wall, so doctors, definitely at the hospital and that sort of thing. And it's about consumers having rights and providers having duties. And in terms of when I talk about consumers and providers, when you receive a health or disability service, you are a consumer, and the person that provides that service is the provider. So health and disability services are really broad in definition, and that may be your GP, staff at the hospital, specialists, physios, dentists, counsellors, staff at a rest home, staff at a disability residential facility. It's really broad. And the Code of Rights covers all of that to protect your rights so that you get a great service. And the Code of Rights, it's not about entitlement, access to services or funding. So sometimes we sort of hear from people, for example, they're on the waiting list to get their hip replaced, and they think that they're too far down on the waiting list and they'd like to be further up on the waiting list so that they can get that sooner rather than later. And that's not always something that we can assist with because they haven't had the service yet. We would work with them to make a plan for them to go forward, but it's not something that we can formally assist with. We can help when you've already had the service or are having the service. So there's 10 rights in the Code of Rights, and the Code of Rights applies to everyone in New Zealand, whether they normally live here or they've just popped over from Australia for the weekend back in the old days. It applies to everyone in New Zealand, and I'd just like to sort of go through what they mean and what they might look like in practice. So right one is about respect. You have the right and you should be treated respectfully, and that includes respect for privacy and respect for cultural values and beliefs. So perhaps an example of what this might look like is if you feel that, you know, perhaps certain crystals might assist in your healing or, you know, make you feel faster or help you feel better, then the provider should respect that that's what you believe, that you think that those will help you, and they should be respectful around that. Right 2 is about fair treatment. You have the right to be treated fairly, and you shouldn't be discriminated against, coerced, harassed, or exploited. Part of my role is I go into rest homes, and this is one that I always talk about in terms of people shouldn't be pushed into doing something that's easier for the staff or easier for the nurses or the doctors. They should be able to have the choice of what they feel is best for them, not what's easiest for everyone else. Right 3 is about dignity and independence. So that means services, whatever those may be, are provided in a way that respects an individual's dignity and independence, treats them in a way that values them as an individual. And basically, the easiest bit about that is people should treat you the way that they would like to be treated. And when I speak to providers, I always really hammer home that point, is that if you wouldn't want to be treated in that way, don't do it. Right 4 is about proper standards. So consumers have the right to receive care that is good for them and that suits their needs. So that means that services are done with reasonable care and skill. You know, providers should be complying with all the legal and ethical stuff, but also that the services minimise harm and optimise quality of life. That's really important to us. A big part of Right 4 proper standards is about consumers having the right to cooperation between providers. I can see people in the chat, but I can't see what you're saying.
Oh, it might have been me. I was just asking, are you still on the first slide, or have you changed the slide?
No, I'm changing the slides. Hold on.
Yeah, I don't know about anyone else. I can only see the first slide.
Oh, hang on. I had the PowerPoint open in 2 windows. Is that any better?
Yeah, now I can see
Fantastic.
Code of Health and Disability Services.
I'm sorry,
is that right?
everybody.
Perfect.
Yep. So you should be able to see a bullet point list of the rights.
Yep.
Is that right?
Perfect. Yep, that's great. Awesome.
I'm very sorry, everybody.
That's all good. We were still listening.
Yeah, you didn't miss much. In terms of proper standards, consumers have the right, you have the right for providers to cooperate to ensure continuity of care, and again, care that works well for you and is suitable. So the example that I often give is to do with maybe specialists and your GP working together to make sure that you receive care that works well, that helps you, that minimises harm and optimises quality of life. And you know, that is in everything. So that may be your doctor, your pharmacist, the specialist, the X-ray tech, all working together to make sure that things flow well and that nothing is missed. I often talk about blood tests. One, it should be made really clear to you if you have a blood test, whether they'll call anytime or whether they'll only call if something's wrong. But also, it should be clear who follows up on that blood test. Is it the specialist that ordered it, or is it your GP? And they should work together to sort of work that out and make sure that your care is really good. Right 5 is about effective communication. And although people might not think they're calling about communication, it is the most common theme that we see at the Advocacy Service when people want to make a complaint, is because communication hasn't been clear. So you have the right to be told things in a way that you understand. So that may be a language and a manner that works for you. If you need an interpreter, one should be provided for you by the provider. And also it should be done in like an environment that's nice and quiet, it's private, you don't feel like you're really rushed, and you have that time and that space to have a really open and honest conversation with the provider, you know, wherever that is, about what's going on, able to ask any questions that you need to. They can ask you any questions that they need to, and you have that honest and open chat about what the service is. Also, I do presentations to providers as well, and I always mention this is about jargon. There is a time and a place for, you know, using the appropriate medical terminology and being really accurate, but that only works if the provider has checked that you've understood what they're saying. I know for me, if the doctor starts talking about something I've never heard of before, I leave the doctor's office and I think, I don't really know what that was about, and I don't think I'm any better off now. So if they're using too much jargon, call them out on it, you know, let them know, actually, I don't really know what you're saying, and can you try and explain it a different way? But the onus is also on them to be clear to you. Right 6 is about the right to full information, which means that you have the right to know everything that you need to know about the care or support that you receive. So that may be, you know, being told what's happening now, what your condition is, and what will happen in the future. So in terms of whether there's any treatments or medications that you may need, you know, what your choices are. So in terms of this medication versus that medication, this procedure versus that procedure, versus not having that at all. You know, the options of going through the public system or the private system. You know, everyone has the ability and the right to seek a second opinion if they're not sure. And I would recommend that if you're not sure, see someone else. But also things like how long you'll have to wait, how much it will cost you, what the risks are, what the benefits are, basically what's happening now and what will happen next. But you also have the right to receive a written summary of that, which can be really helpful if you're a bit like me and you can get a bit overwhelmed sometimes when you're under pressure. It's sometimes really nice to have that written summary, and you have the right to get one of those. Right 7 is about informed choice and informed consent, which is a discussion. It's not just a signature on a page to say that, oh yeah, I've read this sheet and yep, that's fine. It must be freely given. So it links so closely to full information and effective communication. You can't consent to something that you're not fully informed about, and that if it hasn't been, you know, communicated effectively. In terms of who can give consent, everyone in New Zealand under this code is deemed competent to be able to give their consent, unless there's a, you know, reasonable grounds to believe otherwise. So that may be, for example, someone that has Alzheimer's or dementia. They may not be able to consent, and that's when sort of the power of attorney or welfare guardian may need to step in. But generally, it's considered that everyone can do that unless there's something, you know, a red flag saying otherwise.
Lillian, can I just ask a question, please?
Yes, of course.
As for what age do you go up to? If we're looking at children, are we looking at 18 and above as what under that informed consent?
Yeah, so I guess from our perspective, we believe that, you know, even kids under 18 can consent to some things. Mm-hmm. And this is sort of also goes the other way if there is concerns about competency. For example, a 14-year-old may be able to consent to having a cast put on their broken arm, but they may not be able to consent to like a major brain surgery. There is like a bit of wiggle room there, but informed consent does have to come from someone. So if the medical team feel that the child's too young to give that informed consent, then they may go to the parents or guardian of that child.
Here's an example. What about a 14-year-old who wants contraception?
Mm-hmm.
Okay, can that child actually give that consent, or do you need parental?
I think, generally I think it comes down to the individual practitioner or GP that's prescribing that. I am not aware of anything that says that 14-year-olds can't consent to that, as long as they are aware of the benefits and of course the risks of that medication.
Mm-hmm. Okay.
Yeah, that is a little bit of a grey area. And
yeah, I know. That's why I asked.
yeah. In terms of what we would do if that was a concern, would be write to the provider, contact the provider and ask them to clarify their process and their decision making when they made that choice to prescribe.
Mm-hmm. Thank you.
Not a problem.
It's also quite important to note that they can't get informed consent once you've been given a pre-med as well.
Mm.
Yeah. It has to be when you're fully competent to take in what they say. And
it goes the same with drugs and alcohol as well. If they're under the influence, they won't be able to give informed consent.
Yep. And it also people under the Mental Health Act as well.
Mm-hmm.
When they're under compulsory treatment orders and that sort of thing. It is quite different. There's actually specialist district inspectors around New Zealand who deal with specifically that side of things when drugs, alcohol and mental health are involved.
Can I just ask the question with the oh sorry, about to cough. With the pre-med stuff, I had no idea that was a thing. So like what does that kind of mean? Because I don't really understand what the pre-med sort of stuff means.
Do you want me to do that? Anyone? Okay, so the pre-medication is given and it actually alters your mind and your thinking. And because it's mind altering, you cannot make a decision once you've had a pre-medication that changes the way your brain is functioning.
Okay.
Does that help? That's a very simple way of putting it. But it actually just alters your consciousness, and it actually can put you under where you just can't make a informed decision or choice.
So are these classes like legal things?
Pardon?
Are these classes like things that would be like classes like illegal if they were to ask you to consent to things with pre-med and things like that? Or does that sort of fall into like a grey area with that?
No, it's illegal. It comes under legal. The kid, you have to sign off for a pre-medication. Yeah. So, and just when the doctor or consultant comes along to do the paperwork for a surgery, anaesthetic, everything needs to be signed off. There's a lot of paperwork involved in surgeries, and pre-medication needs to be signed off, and you've got to give consent to do that.
Cool.
Yeah.
Okay.
Thank you.
A way that would work really well, I had my wisdom teeth taken out at the end of last year, and I went under general anaesthetic, and so there's obviously the stuff about the anaesthetic and there's the stuff about the surgery and all of the forms to sign and talking about the risks of if we slip with the drill, we're going to make a hole, and when you drink water it'll come out through your nose and that sort of thing. They did that at an appointment, 3 weeks before the surgery, and that worked really well because obviously I hadn't had any of the anaesthetic. I didn't have the medication that they gave me because I was really nervous because it was so far in advance, and that worked really well. I think Sometimes if it's a more urgent surgery, that is a little bit more challenging, but they should still do their very, very best to make sure that you give that full informed consent.
And with that, if you are under the influence of drugs or alcohol, and you aren't able to consent through forms or whatever, or you didn't, how do you go about going through like legal things with that?
Yep. So that's sort of the second part of this presentation. There are options available in terms of getting that addressed, which I'll go through in a few minutes. Yeah. So right 8 is about the right to support. Everyone has the right to take a support person with them to, appointments and that sort of thing if they want to. They can choose who supports them, and they can also choose not to have someone to support them if they don't want that. The only time that a provider really should be stopping a support person coming in is if it's a concern about other people's privacy, or it's a health and safety concern. So we sort of got a lot of queries about this over the lockdown, with people saying, oh, they didn't let my husband into the surgery to support me during my appointment. And that was obviously a health and safety concern. It's really good when providers can think outside the box in terms of what other options are available. So, putting someone on speakerphone if they aren't able to physically be in the room. Zoom and Skype were really good. But yeah, generally, you do have the right to have a support person with you, and that can be really valuable. Right 9 is about teaching and research, and it basically says that all of the rights in the Code of Rights still apply to you if you're in teaching or research sort of situation. So that may be like studies, studies by the hospital about, I don't know, people that are left-handed or whatever it may be, but it also includes people that are training, so trainee nurses, doctors, staff in rest homes, they all come under this. You can choose if you want to be part of someone's research or someone's training. And if you don't consent to being in that study or having that trainee nurse as your nurse, then that must be respected by the provider. So for example, you can consent to being part of training and research, but you can also withdraw your consent at any time. So for example, I went to my doctor, she said, I've got a trainee with me today, is it okay if she comes in and observes? And I said, yep, that's totally fine, because how else will they learn to be a doctor if they can't watch doctors? When the trainee doctor came in, it was actually a girl that I knew from high school. And I thought, oh, I wasn't expecting it to be somebody that I knew. And I thought, this actually does make me a bit uncomfortable. So in that situation, I did have the right to withdraw my consent, and the doctor would have had to send the trainee away.
Yeah.
But in terms of the research side of things, researchers should be honest with you. They should give you full information and effectively communicate with you about what the study's about, how many people are involved, how many people will see the results, how your privacy will be respected if it's that sort of study. They should give you full information about what's going on. And again, you can consent or you can not consent and withdraw.
And if you don't consent, your treatment should still be the same.
Yep.
You shouldn't have a secondary grade treatment because you don't want to do the study.
No, definitely not. You should be treated the same whether you consent or don't consent to being in research. And that comes down to right 4 about proper standards. The care that you receive should be as good as they can make it, really. And that's suitable and good for you. And right 10 is about complaints, and the simplest thing is everyone has the right to make a complaint in any way, and they shouldn't be treated differently because they've made a complaint. So every provider should have a complaints procedure that allows for fair and efficient resolution. And part of that is that people aren't treated differently because they've made a complaint. And we hear that quite commonly, you know, oh, I'm worried that the nurse will be mean to me because I made a complaint about her. You know, she's not allowed to be. They must treat you the same. And in terms of making a complaint, there are obligations for providers to respond to complaints, and there are timeframes in place. So if you do make a complaint, it's not, I mean, the provider's not able to like lose it or misfile it or anything. They must respond to you. So I encourage people to make complaints, not just because it's my job, but also because I really strongly feel if people don't make a complaint, the provider doesn't know that something's gone wrong, and so they can't fix it. And I think that's, is this still working? Yeah, so you can complain about anything you want, can be small, can be big. And there are many, many reasons that people complain. But the main thing is you have the right to, and if you feel like you want to, you should. So, you know, again, if you don't tell the provider that something's wrong, they won't know. It's your right to make a complaint, and again, the provider's not allowed to treat you any differently because you've made a complaint. That would be completely inappropriate, and you know, I would be recommending that if you do find that, you take it further. So there are many options to make a complaint, and they range from sort of more casual to formal to sort of at the top level. So you can complain directly to the provider. So that may be verbally or by a complaint form. Not everywhere has a complaint form, but I know all the DHB ones do, and many medical centres as well. You can write a letter, or you can just put it in an email. You can also complain to the Health and Disability Commissioner, which I'll go over in a minute, what they do, what that might look like. Or you can also make a complaint with support from the Advocacy Service and an advocate like myself. In terms of making an effective complaint, people sometimes like to make their own complaint directly to the provider because they can use their own words. I think that can be really strong, but there are some sort of tips to try and make that as effective as possible and get the best outcome. So keeping it pretty concise is quite important. If you send a 15-page complaint letter, it's not always clear to the provider what the main issues are. So we actually use bullet points at the Advocacy Service to make sure that's really clear. But also, often the provider, you know, they can't change the past. So it's really important to let them know what you want them to do now, you know, what you want from the complaint, what you want the plan for the future to be. If you still have to see that provider on a, you know, regular or semi-regular basis, let them know exactly what they can do to resolve this for you. And if you get stuck, get someone you trust to help you, or you can give the Advocacy Service a call, because that's what we do full time. Where are we? So the Health and Disability Commissioner, they are the highest office in New Zealand for a complaint about a health or disability service. And there's a whole bunch of ways that you can complain to them. They make it really easy. They've got a really good form on their website, actually. When someone does make a complaint to the HDC, They have a range of options and they assess every complaint that comes in individually. And they think about what will be best to resolve this situation. So they may refer it to advocacy if they feel it's something that we could help with. They can investigate the matter if they feel it's really serious. That's about 2 to 3% of the complaints that they get in per year. And you were saying about, concerns about informed consent. That may be something that they're interested in having a look at and assessing what option would be best to sort of get that sorted out. Sometimes they choose to take no further action. That may be if the provider has already given all of the information about the situation and there's nothing really more that can be done. Or they can refer it to another body if it's more appropriate. For example, if it's about medical notes, that's more under the jurisdiction of the Privacy Commissioner because they handle all the medical notes. So I guess, is there any questions about that before I go on? Fantastic. So the Advocacy Service, we are a complaints resolution service. Our role is to try and help people get things worked out so that they feel like their complaint is resolved. We're always happy to chat with you about what options are available, what your situation is, and sort of assist you where we can. Our service is free. I'm employed by a charitable trust that has a contract with the government, so there's no charge for anything for you. In saying that, we are completely independent, so I don't work for the HDC, I don't work for the Ministry of Health, I don't work for the DHB, I don't have any contact with them outside of the letters. So people can be sure that I'm not talking about them in the staff room or anything like that. I don't have any vested interests. My interest is helping the consumer, helping you to get your complaint onto paper and to the provider. We're also completely confidential, so I am not allowed to have any contact with the provider or tell them anything about you outside of what you've authorised me to say. So we sort of operate through letter writing, and the person that we are writing the letter for and with, if it's not in the letter that they've approved, the provider does not get told. So they only know the information that you approve of them to know.
Actually, can I ask a question here then? The advocacy services through the DHBs, are they under your umbrella or are they under the DHB umbrella?
Yeah, so do you mean like the consumer advocates?
Yeah, so put it this way, I've made many referrals to the advocacy service through our DHB through the years. So I'm just wondering, are they under your umbrella or is it like a separate one within the DHB that?
Yeah, so they don't work for us. Because we're completely independent, we advocates at hospitals or anything like that. We're totally separate. My understanding is that those advocates work for the hospital and the DHB, although their role is possibly similar to ours.
Okay, thank you.
So we work with you or work with the consumer that has the concern to raise those directly with the provider. We're quite a personal service. The advocate will be with you right from the first time that you call up, right through to when we send the letter to the provider writes back and we sort of discuss that. And our goal is resolution between the parties, and ideally, if there is a continuing relationship with that provider, that is able to continue. So we have two options at the Advocacy Service. We can support someone to self-advocate, which means that we support them to write their own letter to the provider. So that may look like sort of some help with the structure of the letter, or condensing it down a bit shorter. It may look like me telling someone that I don't think you should swear at the doctor like that. and just sort of general editing. And also support about clarifying what do you want from the complaint. Let's make that really clear, because it's no good for the provider to guess. It's much better for us, for you, to tell them exactly what you want.
If you end up having a meeting, would you attend the meeting?
So we can attend meetings that come through the advocacy process in terms of as part of that resolution, as if you need to have a meeting. In terms of general meetings outside of our complaints process, we don't attend those. We do often get people calling and asking, and we would usually try to help them figure out, you know, who else could go with you. Yeah, so it's only if it comes directly from our complaint.
Okay.
And the other option that we have is active advocacy, which means that an advocate can write to the provider on your behalf. That can sometimes work really well for people that may not want to tell the provider directly how they feel. Sometimes people think it's a bit of a confrontation and they don't want to deal with that. Luckily for them, I'm really good at that, and I have absolutely no problems in letting the provider know what's happened and what needs to happen in the future. So with our letters, they're really short. If it's longer than a page and a half, that's too long for me. We keep it really concise. I'm writing on behalf of Mr. Smith. This is Mr. Smith's concerns. Bullet points. The dentist drilled the wrong tooth. It should have been the other tooth. And then the resolution outcomes is what he's looking for from the complaint. We can ask for information and explanation. So that may be information about what happened, information about what the process is there, and sometimes asking about whether they will consider any changes to those processes in light of your experience, to make sure that others don't go through a similar experience. That's quite common to hear, that, you know, obviously can't change the past, but don't want it to happen to anybody else. And that can be really valuable.
Do they legally have to respond to you?
Yes. Okay. But it's not me. I'm not the one with, I guess, the power in the situation. If someone wrote their own letter, they legally have to respond to them as well. So they have 5 working days to acknowledge that they've received the complaint, and then 20 working days to respond. If they need more time, they should be letting you know how long they need and why they need. For example, the person involved might be on leave. But yeah, they have to respond. So in the last financial year, I suppose, we had nearly 20,000 inquiries or requests for information. And those aren't always to do with what we do, but if it's not something that we can assist with, we would always try and send them on to someone that can help them. For example, I talked to a lady who was upset that her neighbour kept letting their dog in her yard. And I said, oh, well, you know, this is what we do here, and that's not something I can help with, but I can give you the number for the council and they might be able to help you. So we had, you know, 2,750 complaints closed. So most of those closed as resolved or withdrawn. That may be because the person has decided that they don't want to complain anymore, they can move on without a response, or they've got it sorted some other way. And most of the people that worked with us were really quite happy with what we do here. So if you or someone you know is having difficulty with a health or disability service, you're not on your own if you don't want to be. You can seek our support. There's loads of us around New Zealand and we're always there, always really happy to have a chat with you about what's going on and what your options are. So we have an 0800 number and they will transfer you and link you up with an advocate in your area of the country. In Christchurch, we have the office here. There's 3 of us in there at the moment, but there's also a Timaru office. Cynthia down there, she's really lovely. We're always happy to chat, always happy to help in any way that we can. And my name's Lillian, and I've been from the Advocacy Service. If you've got any questions, we've got, I think, 5 minutes and we can have a quick chat.
Does anyone have any more questions for Lillian?
Just out of curiosity, do you take on cases that get compensation?
No. So in
No.
New Zealand, neither the Advocacy Service nor the Health and Disability Commissioner deal in compensation. Part of that reason is that funding or finances is not covered under the Code of Rights. It's not mentioned in that legislation. Sometimes, generally, if people sort of get an explanation about what happened and, you know, changes are made so it doesn't happen to anyone else, sometimes they're able to step forward without that compensation. But if they're not, I recommend that they talk to community law or consider the small claims tribunal.
Do you want to stop sharing your screen now, Lillian, and then everyone can come up on the full screen? Oh, yeah,
Hello,
cool.
everyone. Are you still there?
I just had a question about when it comes to complaints. If you don't know the specific person that you're going to make a complaint about,
Yep.
How do you sort of go about doing that sort of thing? Like, how do you basically complain if you're going to complain about like a whole DHB or like a whole ward or something?
Yeah. So in terms of the whole ward, at the DHBs here, each hospital has like, they call it customer services, but it's basically the complaints office. And so if you have a concern about, you know, a whole ward or the way that 3 different wards have worked together, or as the case may be, not worked together, then they can assist with that. In terms of more general systemic concerns about how the system is organised, perhaps about how funding works or is allocated, we recommend either take it to HDC because they have a broader view of the system, where you can only work directly with that one provider. You know, I'm good, but I'm no miracle worker. Otherwise, I recommend, you know, have a chat to your local MP. They know, well, maybe not at the moment if they're new, but they know the movers and shakers at the top. They know who makes those decisions, and they may be able to get some more information for you.
Good evening, everybody. Am I unmuted?
Yep,
Cool.
You're all good.
I'm from Tairāwhiti Beneficiary Advocacy Trust in Gisborne, and I have been an advocate since 2003. Can everybody hear me? Okay, cool. Part of my role is we found that there was a lot of people that were missing out on their full entitlements from working income. So in our area, we set up a independent group to turn around and help people navigate the system, and if need be, assist them to apply for stuff. And as we started the process, we found that there was a large amount of people, particularly with health issues, that were missing out on disability allowance. Unfortunately, that's something that still hasn't changed, and there's still a whole lot of people around the country that are missing out on disability allowance. Disability allowance is reimbursement of medical costs you have to do with your medical condition. We have tried time and time again to get the name of it changed, because a lot of people don't apply for it because they feel quite often they don't have a disability, rather than it's not explained properly that it's really reimbursement for medical costs. Another part of my role is I'm coordinator of an advocacy service here in Gisborne. I am also part of a national advocacy group, and we consult 3-monthly with the Ministry of Social Development around issues that each of us see in our areas. And I also admin a page called Work and Income Advocates. It's a Facebook page. We set up that Facebook page about 4 or 5 years ago when we found that a lot more people were using Facebook and a lot more people turned around and needed somewhere to go for assistance. On the page that I admin, all the posts are anonymous, so people can actually post to the page, and I will answer the question for them or point them in the right direction. We found that a lot of people don't know where advocacy services are in the area or where to go for places where people can help them. So we've also put up a list of, try to put as many beneficiary advocates that we can on the page as well, so that, because it's actually easier for people if there's somebody close to them to help them. A lot of the issues that come through the page, depending on how serious they are, sometimes I go directly to the Ministry of Social Development with them and try and sort them out for themselves. Another part of my role is helping people review decisions or lodge complaints. A lot of people don't know how to review decisions. And because the panel is 2 work and income and a community rep, a lot of people feel frightened or uncomfortable going into that sort of situation. So we help them write up their paperwork to do with their complaint or their review, depending on which it is. And we go alongside them. We try and encourage them to do things themselves, but some people don't feel comfortable doing that. So we actually attend work and income with them, or if it's a benefit review hearing, we attend the benefit review hearing with them, or we help them lodge appeals and point out to them the right legislation or policy that it involves with different information, different practices, policies, legislation within the Ministry of Social Development. And that in itself is quite baffling. When you've got I think they've shortened the job seeker down to, if you fill out a paper, it's 45 pages. It's a lot quicker online, but it's also a lot harder online if you don't know how to do it online. So quite often we have people come to us that I actually help them go online and apply for a benefit. And since COVID's come about, things have changed as to how we apply for stuff, how we get assistance, where do we go? Because depending on what level we are, it depends on whether our local office is actually open. So a lot of people before, if they needed assistance, would just go straight to the office. Now they go to the office and they get sent away to go and apply online or to ring up the 0800 number and apply. So we also help a lot of people, give them the right steps of where do you go, where do you start, and that sort of thing. So and it's changing all the time. Policies are changing all the time. Practices are changing all the time. Some of it's centralised, some of it's not. So yeah, it's a matter of trying to help people work out where to go, where to start, and be able to explain it to them in their terms of what they understand and ensuring they understand what it's about. But yeah, people don't realise until they get on a benefit what a low amount it is and how hard it is to navigate the system and work out, particularly when you're not well, how to turn around and what is out there is there to help you. It's not as sometimes it is portrayed that people are beggars or they're bludgers or whatever. The system was set up to help people. And people wouldn't go on a benefit or apply for assistance unless they had to. Nobody wants to go through that. So the thing is to turn around and if you have a need, apply for it. That's what it's there for. And if you feel that people are judging you or not talking to you nicely, tell them in a nice way that I don't like the way you've spoken to me, or I don't understand what you're saying, because quite often they don't realise that they're not saying it properly. They don't realise they're so busy in their own talk that they don't understand that you don't understand what they're talking about. Sorry about the clock chiming. Disability allowance. It's reimbursement of costs that people have to do with a medical condition. The income limits on the disability allowance are quite high. So for a couple, it's $1,000 gross is the maximum. So if you earn under that, anybody that has medical costs to do with a medical condition can apply for assistance for disability allowance. That's for a couple. For a single 18 plus is $676. And for a sole parent with 2 children, it's $807. So there's an awful lot of people that have medical conditions that are missing out on disability allowance. And the medical costs can be anything to do with your disability or your medical condition. It doesn't particularly mean have to fit into their so-called categories. There's a lot of things that don't fit into, just because it's not in their category does not mean that it is not an added cost to do with your medical condition. Quite often what we've done when it comes down to something that doesn't fit into their category is if a consumer uses it and it's authorised by a doctor, we place it under authorised consumables if it's not in that category. The maximum disability allowance per week is, where are we, $65.36. So what happens is when you have your medical costs, working income added all up over a 52-week period, or what it would be over a 52-week period. They then divide it by 52 and they pay it in a weekly amount. So some people get confused and say, well, my doctor's $30 a fortnight, but they're only giving me $15 a week. That's because your costs were only $30 a fortnight. So it's all added up, and it doesn't always end up looking as though it's what you put in, but quite often when you divide it over a 52-week period, it is what the amounts that have been put in. There's a whole lot of people that miss out on travel. If they have to travel to do with their medical condition, to go to the doctors, to pick up prescriptions, to attend treatment and that sort of thing, there's a whole lot of people that miss out on travel. And what they do is they work out how many kilometres to where you've got to go and return. And if it's above a 2 litre, it's 40 cents a kilometre. If it's between a 1200 and under a 2 litre, it's 35 cents a kilometre. And a less than 1200 is 30 cents a kilometre. So there's a whole lot of people that miss out on that. there's a big difference now between, they used to turn around and say that you could only get a landline included if you connected your phone in your disability allowance, if you connected your phone to do with your medical condition. And because a lot of people always had a landline, they never added phone costs into a disability allowance. Now, a lot of people have cell phones, and they have cell phones for a reason, so that they have a mobile phone on them at all times in emergencies. The basic rental for a cell phone is now around $19 a month. If the doctor puts it into your disability allowance, that can be included into the disability allowance. Particularly with people that have emergency conditions, they should have that cell phone added into their disability allowance. Once your medical cost gets over the $65 a week, it can go into temporary additional support, but it just depends on what your other costs are as to whether it gets included as well. Yes, people have got funding in their disability allowance for swimming. They've also got funding for going to the gym, which has helped out. To get those sort of things added into disability allowance, the doctor needs to approve it. And it needs to be something, the medical condition needs to be going to last 6 months or longer. And it's usually for things that aren't one-off. If it's a one-off cost, they'll quite often not add it into disability allowance because it's not an ongoing cost. But swimming, gym, those sort of things can definitely be put into disability allowance. They need to be signed, it needs to be signed off by the doctor and then worked out what the cost is. And then what will happen is it will be broken down into that weekly amount.
Did you have a question, Brianna, is it Brianna or Brianna, that you asked on Facebook?
Yeah. I was also basically going to ask the same thing, but I've recently applied for the I can't remember what benefit it is. It's not the disability, it's the supported living, I think it is. Because I can't be on job seekers as I've lost my job due to my illnesses. And I was just wondering, is there any way to help with like getting support while you're going through that, or while you're waiting for the process, like the application process and everything like that, and what the differences are between the supported living and the job seekers benefit?
Okay, with the supported living is a higher rate of benefit. And so on a single rate of benefit, it's about an extra $40 a week in the main benefit rate. Supported living means that your condition is going to last 2 years or more. And it also means that it's classed as permanent and severe, and that you can't work over 15 hours per week. During the process, what usually happens is the doctor fills in the paperwork. It is then sent off to Work and Income, and sometimes they'll send it off to a regional health advisor to be assessed to see whether they turn around and feel that you meet the criteria. Health social workers are very, very good at supporting you with the medical side of things and ensuring that Work and Income understand the medical side of things. And then you can either have somebody from community law, Citizens Advice Bureau, or a beneficiary advocate that will help you with the Work and Income side to ensure that you're getting your full and correct entitlements in the process and everything's sped up a lot faster.
Shelley, can I ask a question? It was a question that one of my mums asked. For example, if someone had quite a large one-off cost for a medical sort of device that goes onto the mobile phone so that you can track the heart rates and stuff like that, that can then be sent to the cardiologist. Because it's quite a, well, you know, for some people it's over $100, like a lump sum to purchase. Can they get assistance through that if they're not getting, like if they haven't applied for the disability because they don't feel like the ongoing cost is what they need, but when they need that amount at that time to get that particular item?
Yes, definitely. I would request that it be placed under emergency medical, which is non-recoverable. There's $300 emergency medical that is non-refundable per year, and if the doctor signs it off, then Working Income should put it under emergency medical because it's definitely something that's needed, and definitely.
And is that income tested? Would that be income tested?
Yes, it would be.
Okay, that's good to know. Thank you.
With temporary additional support, there has to be a deficiency before it can be granted. So what happens with temporary additional support, not all costs are classed as allowable costs. Working Income have a list of costs that they class as allowable costs, and anything else can't go into the calculation. So it may be that you have, or somebody has a deficiency in the income, but all of the costs may not be allowable. So that may be why temporary additional support hasn't been granted. So it'd be handy to contact an advocate to get it looked at to see if everything is taken into account.
I just had another question, just with when it comes to applying for the disability benefit and things like that. If you don't have a specialist and you only have a GP, say with like a heart condition or whatever, is it still eligible being signed off by a GP, or does it have to go through a specialist as well?
No, it can definitely be signed off by your GP. Definitely, because your GP, even if you don't have access to your specialist at the time, gets all that information from your specialist anyway. And even if your GP is just as qualified, they're more qualified than half of them at Working Income. So they should be definitely taking into account what your GP is saying. Yeah. So definitely go to your local GP, because your local GP usually knows you far better than the specialist. Like the specialist, you know, they're if you can get a specialist to write it, to have the time to write it, then it means a hell of a lot more. But your GP knows you through and through, and your GP, when you're going through medical issues, particularly with Working Income, is actually your best friend, because they're the person that are going to be there to back you up when Working Income queries anything. So everything that's going on in your medical condition, you need to be telling your doctor, because quite often we just go there and the doctor says, how are you? And we say, we're fine. And we get our prescription and we leave, and the doctor doesn't really know everything else that's going on. So when we need them to fill out papers to say how our medical condition is playing up or whatever, we need to have them informed so that they know when they're filling out that paperwork that, okay, you were fine today, but 3 days of the week, your medical condition is really bad or something like that. So the doctor actually knows all that, because they're actually your best friend when they're filling out that paperwork for you.
You can actually go in too with your letters from the consultations. Like if you've got special diets or supplements you take, if that's in the letter and you've got the receipts for them, they will reimburse.
And how long should you wait to hear back from Working Income once you have sent in forms or whatever until you sort of follow up with them?
5 working days. they actually have a 5 working day standard. And if it hasn't been processed within those 5 working days, then I would be ringing up. At the moment, they have a backlog. Why? Nobody seems to know, because all they're doing is paperwork at the moment. They're doing a whole lot of processing, but they also have an influx of new people coming on benefit as well. So they're doing a lot more processing, but they're seeing less people face to face. So it's a little bit hard to understand why it's not being kept up, but they still definitely have that 5 working day standard. So if it hasn't processed and you've provided everything, then I would keep ringing and questioning why it hasn't been processed. Yeah. And at the end of it, if you're waiting 2 weeks and it still hasn't been processed, then I would be complaining. There's a process online where you can go onto the Work and Income website, and it's called feedback, or you can type in complaints, and it's a feedback link which has complaints and something else on there.
Yeah.
I would be turning around and complaining, because people shouldn't be in hardship. They don't realise a lot of the time that people are in hardship and they do need those things. They have the feeling that eventually it will be backdated, but it doesn't quite help at that time if you need that extra income to buy medication or things like that. Yeah.
The My MSD app is really good too, because you can track what they're doing in there. So if you have a community services card, you can log into that and do an account.
Yeah.
And there's no data as well. It's free for data.
You don't have to have a community services card to log into My MSD. You can log into, people who don't have community services can set up a My MSD account as well.
Okay.
Yeah, and that way you can check through My MSD. There's a phone app or a computer app, and you can actually apply for your benefit through there, or you can apply for assistance through there, depending on what number hardship you're at. So a lot of people that are new coming on benefit do a lot of their stuff through My MSD. But when it comes down to some of the medical stuff, it still has to be, some of it still has to be verified and provided. So depending on whether, initially when you're applying for disability allowance, you initially need to provide that information to show them that you've been 20 times in the last year to the doctors, that your phone costs are this, that your prescription costs are that, you get printouts from the pharmacy and that. But once you've had it, if your costs don't change, then you just have to tick that they haven't changed, and you don't have to provide it again until such time as they do change. And then if you get a new cost that's coming, you just need to provide initially what that cost is and how often it's going to be, but it needs to be signed off by the doctor.
Yeah.
To be added into the disability allowance.
Does anybody else have any questions? Oh, my camera's still off. Does anyone else have any questions for Shelley?
Yeah, I do.
Yep.
So how do we, so you're an advocacy lady, but how do we go to Work and Income without an advocacy person? Do you know what I mean?
How do you mean?
So if I was to apply for like a swimming voucher or something like that, like how do I do that on my own without them saying, no, you've had too much money? You know what I mean?
So what you need to do is to, if you were going to apply to have swimming added to a disability allowance, first of all, you need to get a disability allowance application, and the medical certificate part of it needs to go to your doctor. And your doctor needs to sign there to say this is necessary for your medical condition.
Yeah.
And then what you would do is get a quote from, say, the pools or wherever you're going to go to say this is how much it's going to cost. The doctor's already said in the medical certificate that this is what you need. Excuse me. Then what you need to provide is what the cost is going to be.
Okay. And then
So,
what if they reject that though?
Pardon?
And what happens if they reject that though from the doctor? They go, oh, well, no. Because I've tried once before and they sent me the green card, which was fine, but that was with a bunch of like really, really older people than myself.
Well, if that's not, because what they would look at is quite often they look at is whether there is something covered by the DHB or the local health providers in your area. Now, if for some reason you can't attend those other programs that are free, then you need to discuss with your doctor why you can't attend those and why you need to attend the other program. And then your doctor would support you, hopefully, and give you a letter stating this is the reason why this person can't attend that and they need to attend this.
Mm-hmm.
That's why your doctor is your best friend, because not everybody can go all to the same thing. Some people have major anxiety by being with other people, or they have a whole lot of different reasons why they can't attend a public class that everybody else is attending. So it's really important that you discuss that and talk to your doctor about it as to the reasons why you as an individual can't attend that.
Yeah, that anxiety is a big part of it. Because I'm only all new to all that sort of stuff because I've only just got it. Okay. I've never had anxiety in my life. So that,
it's really important that you explain that all to your doctor so that when they're filling out your paperwork or they're doing support letters for you, they can explain why you can't do that at this particular time.
Yeah. Okay, that makes sense to me.
Yeah.
Okay. That's what I wanted to ask.
And Shelley, just on that, in regards to if someone does get something declined, can you sort of maybe just advise like what some of the steps they can do to have it reviewed? Like what's the best way of doing that?
There's 3 different ways you can do it. You can lodge a dispute straight away on the day that you dispute the fact that they're not granting it, or you can lodge a review of decision in writing. It doesn't have to be on their form, but it has to be in writing to say that you want them to review the decision that they've made. Oh, no, there's not 3 things, there's 2, sorry. And so then you can turn around and if you need to review that decision, then you can contact somebody that can help you write it up if you have to go that far. Quite often if you ring through to the 0800 number and say you want to review that, they will have another look at it, and if it's unfair, they'll grant it.
Yeah.
But what also, when you review a decision, provide your proof or your support letters. Things go a lot further when you have support letters from your doctor, from your support people, from your health social workers, anybody that's assisting you and understands what you're going through and can verify that what you're saying is correct, then those letters will help you a long way further than having to get them later on.
Yeah.
If you know you're going to apply for something and you know it's going to be a little bit tricky, then have those support letters on hand before you apply if you can. It makes it a lot easier.
And that's like when people do the child disability, which is not really related to this, but I always say to write down in a support letter or get someone to do a support letter at the same time. just to prove that you are doing that extra care and attention.
Yes, definitely.
Because I have had to go to a medical review for that before, which was like an appeal sort of situation, which was daunting because there were 4 medical professionals in a room with me. But then once we talked for a little while, it was granted, and it did make it easier the following years. But it's sort of really easy to think, this is too hard, I'm not going to do it.
Yeah. The more information that you provide up front, the less you have to provide later on.
Yeah.
Particularly when it's to do with medical conditions or how that medical condition affects your everyday life. Yeah. Because quite often they'll ask you that when you go to work and income, you're not going to go into your appointment on the days when your medical condition is really bad. You're going to be going to work and income when your condition is fine. And they're looking at you and they're thinking there's nothing wrong. Mm. So it's really important to have that paperwork to turn around. And you shouldn't have to prove it, but it makes life a lot easier for you if you have that information up front saying that, you know, this is what's going on. And that the majority of the time you have good days or the majority of the time are bad days, which happens with a lot of people with medical conditions. As part of our advocacy page, Work and Income Advocates is what our page is on Facebook. And we have people private messaging all the time. So anybody wants to know anything around work and income, that sort of thing, that's what we're there for. Don't hesitate to make contact. Or you can always ring us on the phone number at in here, Gisborne, 0686 877 30 is our local phone number if anybody needs to know anything, because we still, even though I'm based in Gisborne, we still do a lot of answer a lot of questions around the countryside.
Is there a website so we can find our local branches?
There is on Facebook, and if somebody can turn around and is able to copy that onto here.
Yeah, Claire's just put one up now to do with the Facebook group. So
yeah, and
Claire, do your magic.
On the page there, if you're a member of the page, Claire, right at the top with the announcements, if you drop that first announcement down, it's got the contact details of all the beneficiary advocacy services.
Yeah, they're definitely all there. I would probably suggest just join the page to see, because there's lots, like there's Auckland, Wackworth, Whangarei, Hamilton, Rotorua, lots.
And the page is really valuable because as your journey and as you go along your journey and different things crop up, quite often you can, message like through to Shelley and they put it up, and then most current information or someone answers. So it's really good to be part of that page for support going forward. We've utilised it a number of times, hence the reason we got Shelley to come, because quite often if I get a stumped, question and I'm like, actually, I don't know this, I've actually gone and either asked on the page or gone to Shelley to say, where do we start? Because that's what, for me as a family support worker, it's just knowing where to start and where to what information to give to my adult or my family to get them started on the process. Because that's like, like Shelley said, that's that dauntingness of where do I start? What words do I ask? And so I have found that page really valuable. So definitely, if you've got the opportunity to join, I would suggest it's really beneficial. So thank you, Shelley, to you and the team that look after it, because I think that, for the last, year and a half, 2 years that I've been on it, there's about 6 families that I've been able to get them on, and they've been supported through that page. So it's been brilliant.
Oh, thank you.
So will the social workers at the hospital be able to help as well?
Yes, they should. All the social workers, I refer people straight all the time to social workers at the hospital to do with anything to do with the medical condition. If there isn't social workers attached to the medical centres, because a lot of the medical centres have social workers attached to them now as well. If they haven't, then I turn around and do encourage them to contact their local DHB and see who is the medical social worker there, because they'll know who the ones in the community are, because there's a whole lot of health navigators out there as well now, that unless you're in that area, citizens' advice is amazing as well. And another place that I go to all the time is the Family Services Directorate. Their MSD is so slowly updating that. Well, they're not slowly, they've actually done quite well. And there's a huge amount of contacts in there for local areas, particularly food banks and food services, budgeting services, because all those things come into it too when you get a medical condition. Is all of a sudden you're having to finish up work and you don't have the same income coming in, and so there's a whole lot of services that are needed to come into play pretty fast when something, you know, a medical condition happens really fast. So the Family Services Directory is an awesome one for people in all areas, because you'd be surprised what's in that directory.
Yeah, I have a question. Oh, sorry.
Sorry.
Oh no, you go first, Brianna.
Just as someone who's like a single person, like I don't live with my family, I don't have any family near me, no partner, anything like that. How do I sort of find a support worker as such? Because my whole time that I've lived away from my family and been involved with work and income, which has been for about 2 years now, I've never been offered a support worker, and I've never been told how to get one. It's only ever been when I asked, they were like, oh, it's mainly for families. So I'm just wondering how that sort of works for me and other people who are single people.
It depends on what area you're in, and the citizens' advice would be your best place to tell you whether you have beneficiary advocates in your area or whether you have health social workers, because a lot of your health social workers should be able to assist you with work and income as well, or they should be able to link you in really fast with somebody that can actually be a support person for the other stuff that you need as well, not only your health stuff but your work and income stuff. So I'd try your health social worker first and then turn around and see if they're aware, because that's part of their role, is to ensure that, because if your benefit stuff's not sorted and your housing's not sorted and your other stuff, then it's impacting on your health. So somewhere along the way, the health social worker should know the other people to link in with to assist you to get the right help, to get everything set up for you so that it's as good as it can be without you having to worry about, you know, stuff happening. Or you'll know that you have what you should be having. Yeah. What area are you in? Do you mind?
I'm in Hamilton.
Okay.
Yeah.
So you should have some amazing social workers at your hospital.
I've never been offered, or even when I've asked, I was told that I wasn't eligible because of either one, I didn't have a specialist to sign off or anything, or the second time round I got told that I wasn't part of family, so it was going to be harder for them to find me someone, which was really weird.
Yeah.
What about
It is weird.
Heart Foundation and how are they linked in? Does anybody know?
I've recently had one of the ladies from Heart Kids Waikato get in contact with me, but it basically took my mum emailing her and me being like, I need someone.
Yeah, fair enough.
to finally have it happen. But it was more wanting to find out if through the work and income stuff, because she can help with all the cardio stuff, which is great, but it's more needing help with the paperwork and everything I need to get done. That's a bit more stressful.
If it comes down to it and you can't find anybody up there, get hold of Citizens Advice or the hospital. If you can't, then just, if you're on Facebook, get in touch with me and I'll try and give you the information backwards and forwards to ensure that you're getting all you're supposed to.
Oh, thank you.
It's okay. It just makes it easier if you've got somebody on the spot, but if you can't get somebody there, then you're free to contact me. Okay?
Oh, thank you.
It's okay.
Actually, my question was kind of similar as well. If you become a beneficiary of with the health and disability, do you get assigned a caseworker?
Sometimes.
Sometimes, so because with the other benefits, usually you get a caseworker, correct?
Yeah.
Okay.
Well, they're mainly only work focused. They don't. Work focused are the only ones that really get case managers. There used to be health and disability caseworkers, but now that everybody's not going into the office, it's a little bit different. So it's still, they haven't gone back to having the specialised health and disability case managers as such at the moment.
So how does it work then? Because I'm from the old system where I expect there to be a caseworker, whether you're and this is how old I am. The words that I remember was the domestic purposes benefit. So that was way back in the 80s, 90s. I don't know what it's called now. Don't know what it's called nowadays. So they used to have caseworkers. So what is the equivalent for the health and disability?
So what actually happens now is when you go to your doctor fills out a medical certificate and it electronically goes through to a specialised caseworkers processing team. So they have a little bit of understanding to do with medical conditions, but they're only processors. So they look at the initial medical certificate to see whether you would qualify for going on to the supported living, which is the old invalids benefit.
Oh yeah.
And then if they feel that there's not enough information, it gets referred back to the local office, who then refer it to the regional health advisor. So that's getting it initially processed and granted. Once you're on that benefit, until they start working out what's happening with COVID, because most of it, what's happening at the moment is focusing on getting everything processed. And so medical certificates and all that sort of thing have been deferred till next year. So people have to do their initial medical certificate to get on a job seekers with a medical certificate. But the medical certificates have been deferred until the consecutive one has been deferred until August next year, because nobody knows whether we could go back into lockdown or go back in our levels and with the COVID stuff. So they've just deferred all the medicals and everything else. So nobody's actually at the moment monitoring the medical conditions, or they're giving assistance to people with medical conditions and that, but they're not having the specialised stuff as such happening at the moment.
Because they haven't actually said that, because my daughter's on a job seekers with a medical certificate and it's due to run out at the end of this month. And I thought that we had to get a new one, so we don't have to till August next year.
Yeah. It's on the work and income website.
Right.
If you look on their medical certificates, they were getting ready to renew them again, but then when we had the second lot of scare that happened in Auckland, they deferred it completely, because it was deferred until October, November this year. In March, they did it for 6 months, and they were due to start doing them again at the end of this month and next month. But when Auckland, we had the scare with Auckland, they just deferred them out till August next year, just so that they don't have to keep on stopping the computer system all the time.
Because one of the things that they do with those is, like, initially we were told the supported living, but then, like, the GP, being old school, sort of said, oh, you can't go on supported living because you'd never ever get a job again. So he said, do the job seekers with a medical certificate.
No, the supported living, there's actually far more help for people with health and disability conditions than what there is on job seekers. And you actually get more assistance when it's working right to get the right job.
Because you can actually study for a certain number of hours on that too, can't you?
Yeah, on supported living you can.
Yeah.
On job seeker you can't. You have to go on to a emergency benefit.
Right. So how many hours of study can you do on the on the supported living?
Full time if you wish.
Okay.
Just depends on whatever's manageable for the person. Some people can do full-time study, some people can't. Because even if you're enlisted in full-time study with a medical condition, does not mean that you're going to attend full-time every day, because something pops up and you can't attend. So even though you're enlisted in a full-time study, doesn't mean to say you're attending full-time.
So it hasn't got that 15 hours cut off like you do for work?
No, no.
Is the supported living, is there a time factor? Like, is there so many years that you can be on it, or is it unlimited?
Unlimited. It's 2 years. The condition has to last at least 2 years or more to get on the supported living. And there's 2 different rates of assessment. There's 2 yearly assessments or never to be reassessed.
Right.
There used to be a 5-year in the middle, but they've taken out the 5 years. So you either get it renewed every 2 years, you go back to the doctor every 2 years, or just the doctor. If the medical condition's not going to change, it's lifelong, then it's never to be reassessed.
Okay.
I just had another question. Sorry, I feel like I'm asking all the questions all the time.
Good.
So
That's what I'm
sorry.
here for.
Being a young person and going on to the supported living one, both my conditions are lifelong. I was just wondering, does work and income sort of help you in finding like a job that you would be able to, or like dream job as such while you're on it? Because while I was filling out the forms, it like asked you like what your jobs and hobbies are that you enjoyed, what do you think you're good at. I'm just sort of wondering how that sort of works like later on when you can work again, or if you can ever work again.
They do. Part of some of the consultative stuff that I do at MSD was I was on a health and disability working party, and we were working with, there was a whole lot of different range of doctors and all sorts of people were on this working party, and it was all working towards supporting those on the supported living benefit, being able to work and do the best they possibly could and however they possibly could. So there is stuff they are working towards that, but at the moment, with everything being so unsettled, once everything starts to settle down again, then those health and disability case managers will step forward again and start working with people. And the main thing is turning around and letting them know and talking to your doctor about what your capabilities are, where you want to specialise, or what's going to be best for you, that's going to be best suited for you and is going to fit in with your medical condition as well. So that's what they're supposed to be looking at in the future, but with everything being a little bit uncertain, there's, yeah,
that's understandable.
yeah. So I mean, that's something when you're ready, and talk to your doctor first before you, and then talk to Work and Income, because it's very important that your doctor gives you the letter to say, yes, you can work, but only this amount of hours or in this particular field of work, so that you're not all of a sudden, yes, she's here, she's ready to work, and let's go and shove her there. They're going to put you in the right employment and work with you the right way. Yeah.
Do they work with Workbridge in that as well? Other organisations that support disabilities?
Yes, they have done. Yeah, they have done. It depends. Workbridge is already contracted to them anyway, so, and always has been. So it just depends on the particular people as to which service they. Some people go to Workbridge, some people go to. There's a varied amount of people that work with people with health and disability into employment. It's just, the thing is finding the right place for you, because some of them are funded specifically to just get people into work. So it's finding the right service that's going to take notice of your medical condition and fit you into the right employment that's going to suit your medical condition, not just because they're getting funded to put people into work.
Does anyone else have questions?
Oh yeah, I've just thought of one. So Shelley, do you have a list of grants and funding and whatever other benefits that people can apply for? Is there like the list, or is that information that doesn't get given out?
Or as in,
so if you are on a benefit,
yep.
You know, how do you know what things you can actually apply for? You know, is there a list of things that, you know, I expect the case managers to have it, but do you as an advocate have that list of what grants are available, what things that people can actually apply for?
It's readily available to anybody on the Work and Income website, and it's under manuals and procedures.
Cool.
You know where that is, eh, Monty?
Yes, I was just going to say, it's one of the things that probably why I was so passionate about like tonight's event and getting you along, Shelley. Just a little bit of background. A number of years ago, when I was doing my social work degree, I assisted AAAP, and that's where I met Shelley, where we supported people to get their true entitlements. And at the time, it was important for me to learn that, because my sister, having a heart child, needed to know that information. And it was really amazing that what you just don't know. And it does take time, but definitely do go onto those pages and have a read, because, you know, it can be as simple as getting the right bed for you. And, you know, going in and they say you can get this type of bed. But again, like Shelley said, you know, going to a doctor and getting them to say, no, they need this style of bed and this type of bed. It just gives you that support that when you go in, you get the confidence to ask. You know, yes, we had to do a number of the review processes, and like Shelley said, the minute I would say I'd like to review that decision, the manager came over and was like, oh yes, we can approve that for you, yes. And I think it showed empowerment, and that's why tonight, having, you know, both Lillian and like Shelley come and just showing and giving, you know, users, everyone as individuals, the power to ask those questions, like Brianna tonight, you know, asking those questions and getting clarification, and knowing now that there's places to look, to talk to ask, it's really important. So yeah, so that the website, looking through the manuals, it was amazing to learn, like, you know, the emergency grants, the non-refundable grants, and all things like that, that every now and then will pop up. And, you know, speaking to an advocate quite often when I would say, look, this is what's happening, and they would say, you need to go in and ask under this, or you need to go and have a look at this, and that's how you ask, or that's the way in which to process it. So yeah, definitely become familiar with the website. And then I would then use the Facebook page as well, because quite often, you know, if reading the website throws you off a little bit and you're still not needing that clarity, that's when I found going like to Shelley and advocates, just to gain that next level of clarity of what can go forward, has helped.
So what I've done in the chat, I've just added where the manuals and procedures is, the link to the manuals and procedures. And then when you go on to that, you can see on the left-hand side of it, it's got income support, and that will show you where your main benefits are. And also next to it is extra help, and that's where all the categories are for the extra assistance, like accommodation, supplement, advances, food grants, all that sort of thing is in under extra help. So, and anything else that anybody wants to know about that, then you can just private message me or start reading. It'll take you a while. There's a lot in there, but it's very, very helpful. So but keeping in mind that that is their policy and procedures. So when you read something that it says in the manuals and procedures, and you still feel you fit into that category, then you then take one step further and you look at the legislation, which is slightly different from the policies and procedures. The policy and procedures is their way of saying this is what we think the law means. It doesn't necessarily mean that that's what the law means. That's just if you wanted to take it a little bit further. The legislation is in there as well.
Yeah, and I think that's really important, because I know that with some of the families that I've worked with, you know, there's an entitlement of how much, say, for example, for food grants that you can get within a year. But, you know, for some of our families, you know, they have, you know, maybe a really horrific year where that entitlement has been used up, yet they're still in such a bad situation. And I know that we have utilised an advocate before to get above and beyond, you know, and it's always case by case, it's always circumstantial. But, you know, I know the difference for that family when, you know, they were able to have that support to go in and to get it, because, you know, quite often they're already in a really vulnerable state, and to go in and get a no, like you say, quite often they just prefer not to go in, and they've said no, I've got nothing. That's when they stop, and that's when they look outside, which may not be as, you know, favourable, or they go without. So I have learned that, like you say, having an advocate or a support person can really help if they have to go down that extra road of, you know, getting a review of decision or anything like that, and knowing and having like the legislation and the policies behind them really helps.
Yeah. So Shelley, when someone asks a question on your Facebook page, does it go to private message and then you take all their names out and post it?
What happens is they post to the page, and then I copy and paste their post to the page as anonymous.
Okay.
Yeah. So none of the posts go on there. The only way they can sometimes identify who the person is if they respond to some of the answers, and then people identify it's them.
Right.
But yeah, otherwise I'm the only person, or Kay sometimes if she comes on the page as an admin as well, who can see who the poster actually is. And then if they need further help, then I private message them and take it from there. Nobody even knows what's going on in the background in those situations.
So is your organisation an NGO, or how do you?
Community funding. Yeah, we stay independent. We get a small amount from MSD, and the rest is all community funding because we need to stay independent so that we can challenge. Yeah. Otherwise, yeah, we wouldn't be able to do. We probably, if we turn around and became government funded, we wouldn't have the Facebook page that we have today.
So has MSD ever approached you for information about particular people?
No. MSD, I know, are on the page, will monitor the page. Even the minister, when we go to see the minister, we go to Wellington, she quite often talks to me about, oh, I saw your page the other day. So they do keep an eye on it.
Yeah.
And, but they can't track it. They can't see who it is.
Right.
But they do turn around and if ever I refer anything through to MSD, it's always with people's consent. I get their contact details from them, and then MSD contacts them directly to give verbal consent to look into it for me sending the information away. Right. Or otherwise I send them written authority forms for them to fill in. So there are cases that do get referred through to MSD, but with people's consent. MSD doesn't have any control or doesn't ask anything about who was that person that posted about that, because they know there's no way I'm going to tell them unless that person wants me to tell them. Yeah. Because there's some really sad cases that come through. Sad in the situations that are happening and everything else. And in some of the cases where people could be helped by work and income and have approached them and haven't been given that assistance. But they soon get sorted out once they give consent and they go back via me back down to MSD. Because depending on how serious it is, whether it's just dealt with locally, regionally, or even nationally, some of them go straight to head office.
Has anyone else got any questions? That was really good, Shelley. Loads of information, and I joined your Facebook page a couple of weeks ago after Monty told me about it, and I'm amazed, like, there's so much interaction in the page, and like the one question's completely different to the next question, so it's obviously still a real subject that people are really still, you know, navigating and looking into it. So that page, I can see Matilda's actually just this evening shared it into our Heart Adults Facebook page, and hopefully some of, you know, the families or some of the adults will go in there and get some more information. But Brianna, I want to say thanks for all your questions tonight. I know you said you felt like you were taking over, but we tend to not really get many questions, so that was fantastic tonight.
Oh, I'm glad I could ask them all.
Yeah, that was really
awesome. Good. Yeah. That's
Absolutely.
What I'm here for. Yeah.
Yeah, and I agree. I think, you know, like, you know, your question I saw that you'd put on to Claire, you know, that was that, okay, great. There is someone who's coming with an intention to ask questions, because that's why Shelley's here. And if only you turned up tonight to ask those questions, then that means tonight was worth it. And I'm sure the other, you know, other adults who may not have asked questions will be banking that information, taking that knowledge with them, and will now be empowered if they get into a position where they need these questions, will ask their family support worker to remind them, where's that group, where's that page, or to speak to, like, you know, message the group or contact Shelley and them. So, you know, your questions were so valuable and so good that it really helped bring out, you know, further questions from other people. So thank you.
And thank you so much, Shelley, for giving up your time, and thanks to Lillian, she's gone already, but yeah, really appreciate it.
Thank you so much, Shelley. Thank you.
Thanks, Monty.
Yeah.
Yep.
So
thank you, Shelley.
I sort of think maybe we just we might call it a night now, do you think? Because we've gone 9 o'clock.
I've taken up all your time, sorry.
No, it was so good. I think all our brains are full of knowledge between the 2 years, and it's, yeah, it's been really, really, really interesting. So thank you very much, and thank you everyone for coming, and hopefully we might see you at the next one, which Monty or Matilda might be able to tell you what it is.
It's our Christmas event that's coming up.
Christmas event's the next one.
Okay.
Yay.
So it's all about socializing, connecting people.
Yeah, be good. Hopefully we'll see you guys there.
Bye,
Thank
everybody.
you.
Thanks,
See you
Shelley.
later.
Thank you.
Right. Bye.
See ya.
Double check our chat. Just us. Yeah.
Done. I just decided to call that the end because it's already 9 o'clock.
No,
Yeah.
that's the right thing to do. I
I
think.
think it was plenty.
Yeah, and I think you did right not going into the questions because we needed